Good evening and welcome to another episode of BuyBrevard.com TV. I'm your host, Michael Gall, and with us in the studio this afternoon is Angelica Kotchak. Good to have you with us from Kindred Hospital, and you're the CEO.
Yes, I am.
And we are really excited to have you explain to our community about what you have now brought here, because this is something our community didn't have, but really helps to put us on the map. Tell us about what Kindred Hospital is all about.
Kindred Hospital is a long-term acute care hospital. Our average length of stay is over 25 days. We treat medically complex patients such as ventilator patients, wound care, infectious disease. We have an 8-bed ICU, so obviously we can take very critical patients that come in from the other hospitals in the surrounding area.
Now, you not only will take patients, obviously, from right here in Brevard County, but you'll get fed by the Orlando area, maybe Daytona. How far south do you go?
We go down to Indian River and Sebastian. Then that gets into our Palm Beach Kindred territory. We go all the way north to Titusville Parish, and then obviously the East Orlando area.
Okay. Now, one of the other things that I seen when I went through the tour of the facility, which I thought was really amazing, was one, the state-of-the-art surgical suites. And for the general public that doesn't really understand how that works, this is a real attraction to physicians in the area, wouldn't it be?
Yes, that's correct. Initially, when Kindred did the feasibility study for the area, some surgeons were having trouble getting OR time. Obviously, times have changed a little bit with the economic status of the community. However, it's still there, and we will utilize it for our own inpatients and possibly outpatients.
And then you do some unique things in terms of the use of the hospital with practicing physicians. Again, the public doesn't necessarily understand, well, why can't you see me at Holmes, or why can't you see me at Wusthof? And that has to do with how they have their privileges and whatnot. How do you attract physicians to utilize your facility?
Basically, it's through marketing. We approach the physicians, the certain specialties that we need. Obviously, we don't need OB or that type of a service. So we have a medical director who is Dr. Richard Bainey, Jr., and he also recruits physicians for us. So we go out, we explain what we do. We have physicians wanting to know all the time, come in, meet with me, and find out exactly what we do and how they can be involved.
And how is your relationship with the other hospitals in the area? Are they welcoming you in because of what you have?
Yes, we are absolutely welcome into the community. It is an option for them to send their patients. A lot of their patients had to go to Orlando before, or to Jacksonville, or even further south, Fort Lauderdale. So this is definitely, they've welcomed us with open arms and appreciate having a facility like ours in the community.
And Kindred certainly not only operates here, we talked about the east coast of Florida, but throughout the nation. How many different locations do you have?
There are over 80 hospitals in 40 states. Kindred also has a nursing home division and a rehab division.
Oh,
so,
okay.
Yeah.
And some of those other divisions also exist here in this state as well,
yes,
right?
Correct.
Some of the other facilities.
Right, we have 10 facilities in Florida.
Now, only because I have worked with the senior community and have had clients myself and different things that we do, I know some of these things, but again, the community would not recognize really what a big scoop it is to have an acute care facility like yourself in a community our size.
Right.
Normally this would be something you'd find in the larger metro areas.
Exactly.
Isn't that true?
Yes, it is.
So it really kind of helps put us on the map.
Yes, it brings something to the community that wasn't here before. It allows patients and their families to stay in the community, not have to drive for visitation to another city, another county. So I think it's definitely something that was needed.
Well, and it's great to have you on BuyBrevard.com TV, because we're about trying to keep local business local.
Absolutely.
And when patients, in this case, are able to stay here for that whole continuum of care that supports obviously the DME, the durable medical equipment, the pharmaceutical, all of those kind of things, because we can keep it right here in the community.
Absolutely.
Well, it's great to have you here with us today.
Thank
and
you.
Wish you best of luck.
Thank you. Appreciate it.
Thank you for joining in with us today at BuyBrevard.com TV. We hope that you'll tune in with us next time, and have a good day.